I'm Felicia, I'm one of the nurses at Minneapolis Plastic Surgery, and I'm going to be showing you how you will be performing your drain cares after surgery. So this is the drain. This is what it looks like. This part will be underneath your skin. You can see all those little holes. That is what's drawing the fluid out so that you can heal appropriately. Right where that knot is, that's where the stitch will be. So there's going to be a stitch that's holding this in place so it doesn't get tugged out. The rest will be outside, and this bulb will be connected to your binder with a safety pin. So every day you're going to be stripping this drain, and that's because there's nothing in this line to prevent any clots from forming. So you will have those, and that can stop this from pulling out, and that can leave you with inaccurate results on your output. We need that output written down every day so that we can know when this is supposed to come out. We do not want to take it out too early, otherwise you'll fluid and then you won't be able to heal properly. So every day, right before you're about to empty this, you are going to strip. So I like to take 2 alcohol, just gauze. You're gonna have clean hands first. Wear gloves, hand sanitizer, whatever you need to do, but make sure they're clean. We don't want to accidentally introduce any bacteria. So you're going to start at the closest area that you can get to without touching that little stitch. This hand that is closest to the patient or you is going to be your anchor hand. That's so you don't accidentally tug the drain, which can be uncomfortable. This will be your anchor hand, and this will be your stripping hand. What you do is you just push down and gently pull the drain. Don't try to overstretch it, but just make sure that those little clots are moving and you're having fluid that is coming into the bulb. That means that it's still patent in an open line. Keep doing that all the way down. Just keep moving your anchor hand as you get farther. And then you're at the end. Whenever you're emptying this, you're going to go to the bathroom. I always say go to the bathroom and keep this drain output sheet in the bathroom, just so it's easy to have and you always have it in the right place. Have a pen in the bathroom because you're going to be walking to the toilet to empty this. Whenever you empty it, you're just going to take it off of suction, so that little bulb right there. That's when you're going to read the output. There's numbers on here. Just a guesstimate is fine. It does not have to be precise. Write down the date and time, which drain it is, and how much output you have. When you're ready to empty, you just pull these back and just squeeze it out. That way you don't have bowls to clean or anything like that. You don't have messes to clean up. It's just right in the toilet and you can flush it down the toilet. You're gonna put it back on suction. I like to fold and then just pop that top back on and just reattach it to your binder. I'm going to show you how to do that on a real patient too, just so you can see the fluid actually moving down the line. Okay, so this is what the drain actually looks like. This is what the fluid will look like. So you'll just go from wherever you can reach, take your anchor hand again, and take your stripping hand, and just gently move down the line. Make sure that you're moving that fluid through. It's okay if it refills immediately, that's normal. Keep going down, watching the bulb, making sure that there's fluid accumulating. And that's that for stripping. Whenever you're emptying it, I'm gonna put gloves on. I'm gonna put gloves on, but you can just have clean hands. But I say take it to the toilet. This is just what we're gonna be using right now. But you're going to unsuction that top, read the line. So like that, I would just guesstimate maybe 15. It does not have to be precise. You're gonna pull all these back so that you don't get them dirty, and just squirt it in and take that. It's okay if there's still some fluid and you won't be able to get all of it out. And I say, I like to fold, pop that top back on, and you're done. Thank you.